Okay, so I'm going to be practicing how to do a Foley catheter into my fake patient today. And I'm going to start off by washing my hands and providing privacy. And I'm going to also go ahead and put on gloves. And I'm going to come over and introduce myself to the patient. Hey, I'm Charlene. I'm going to be your nurse today. Can you tell me your name and date of birth? And they tell me. And I'm going to explain to them that I'll be putting in a Foley catheter and what it is, and ask them if they have had one before. If she hasn't, that's fine. I will explain that she will experience some discomfort, but if she has, she will kind of already know it's not the best thing. So I'm going to explain to you that we're putting in a Foley catheter according to your doctor's orders, because you have some urine retention, which just means you're holding some fluid in, and we need to get your urine on out, okay? So I'm going to go ahead and uncover you, and I'm just going to take the blanket out of the way, but usually I will try and keep the patient draped. And I'm going to position the patient in a lithotomy position, and then I'm going to go ahead and take these gloves off and discard of them, and I'm going to open up my Foley catheter package. So as I'm opening it, none of this is sterile. That's why I'm going to use this bag as my trash. Try to. Okay, so this is trash. And I'm going to open it up away from me and make sure I do not cross my sterile field. Normally the bed would be up to waist level, but this is what I have to work with. And pull that off. I'm going to go ahead and turn this up a little bit. Okay. Let's pull that one back over. I'm going to go ahead and place my sterile gloves over here for the time being. And then I'm going to take my sheet, shiny side down, it's 1-inch borders, and place it under my patient. Okay. And then I'm going to take and discard of this sheet without breaking sterile field. And at this point, I need to put on my sterile gloves because now everything is sterile. So open these up. Make sure I don't break any of my other fields right here. And I can dispose of this. Now, I'm going to turn my box sideways, and I'm going to dispose of that little paper. Don't need it. I'm going to go ahead and open up my iodine. Place them on my tray. Throw it away. And take this off. I'm going to squirt a little bit of lube in here. Dispose of the packet. Still making sure to not break my sterile field. Now I'm going to take the plastic off of my little tube, actual Foley, without letting it flop everywhere. inspect the end, make sure everything's good. I'm going to look and make sure the size is correct. It's a 14 French, and that is what the doctor has ordered. Lay that back in here and insert the end. Go ahead and insert the end into my lubricant. I'm going to take and attach my syringe to the port for the balloon. Make sure it's attached very well. Place this back on here for the time being, and I'm going to bring it over to my patient. So now I'm going to be placing my hands on the patient again. To keep sterile filled, this hand, my non-dominant hand, will be my non-sterile hand as soon as I touch the patient. So I'm going to place my hand on the body, and I'm going to take and clean the furthest labia with one sweep. Go ahead and discard that. And then the closest to me down, discard. And then straight down the middle and discard. So now I can discard of this. And I'm going to actually turn my box again to have the Foley facing directly straight towards the patient for an easier insertion. Okay, so I still have to make sure that I do not touch the patient with this hand. It is got plenty of lube on it. Okay, so I'm going to tell the patient that they will feel a little discomfort, and to just bear down for me, and a little bit, they're going to also feel a little bit of pressure. So I'm going to insert without touching the patient. Okay, and I'm going to see a flash of urine. And then for women, you go ahead and advance 1 to 2 inches, and for males, you advance 3 to 4. So I'm going to advance a little bit. And then at this point, I'm going to grab a hold of my catheter so it does not force out, because the patient is still bearing down. And I'm going to start to inflate my balloon. And pop it off. Dispose of that. Okay, and then I will give it a little bit of a tug. I'm pulling this with my sterile hand, and it's good. Okay, so it's not coming out. I'm going to take and bring my Foley back over here to the patient. You would attach a stat lock here with your port to the patient's leg, so you would still have plenty of room. And then I'm going to take and bring my Foley bag, over to the side of the bed and attach it to the actual bed, not the side rail. Okay, and so then at that point you're through, and you would clean up the patient, get rid of everything. And also, before we had started, you would have performed peritoneal care to make sure they're clean before we start, to reduce infection or any dirt or nastiness getting in with the catheter. So when I come back into the patient, it would be at least 24 hours later, and I would start back over by introducing myself and uncovering the patient as well. And then I will go ahead and drain the bag and just place it in front of my patient, disconnect it from her leg. And this, you do not need sterile gloves. I would take a syringe, and while I hold onto the catheter, I'm going to place it back onto my port end, make sure it's secure, and go ahead and start taking out that fluid. You want to make sure that you take out the same amount as you put in. Okay, so I have off. And yep, 6 cc's, that's how much I put in. Now I will tell the patient that they will feel a little bit of pressure. It's not going to be as uncomfortable as inserting, and you will just need to go ahead and pull out the catheter and inspect the end, make sure it still looks the same as if when you put it in, and it's not broken off or anything messed up, and it is. And then I will take this and put all my stuff and dispose of everything and clean up my patient again with perineal care and cover them back up. And that is it. You can stop it.